Hello, this is the video for the Adult Neurology Telehealth exam. My name is Dr. Melissa Coe. I'm a neurologist and a neuro-ophthalmologist. Joining me on this video in the role of the patient is my colleague, Dr. Devin Mackey, also a neurologist and ophthalmologist. He's an associate professor in neurology and ophthalmology and an assistant statewide clerkship director for the neurology clerkship. So you're about to start the clinical neurological exam via telehealth. And obviously, usually you have all your tools available to you right there in the office that is not going to be able to be applicable in the home setting when the patient's where they are and you guys are socially distant. So a couple things to prepare in advance of the visit. The patient will need a couple items. One, they have a flashlight or a pen light, or even the flashlight feature application on their mobile device. That will be perfect to use when you're going to be utilizing the segment, checking their pupils. If they have a cotton swab or a piece of fabric, we're going to use that part for the checking of their sensation. And it's helpful if they can have, like, say, a Ziploc bag with a couple ice cubes in it. You'll be able to use that also for temperature testing. A piece of paper and something to write on for our cognitive portion of the exam. And then for many people, they oftentimes will have available a home scale. That way you can at least obtain their weight for that day as part of the vital sign check. If they have a blood pressure monitor, that's super helpful too. Some people may not. But if they do, that's fantastic. There are a couple links that I will have a separate document to be able to guide you towards for access for the patient to click on that will enhance your visit with them. One is when you're testing their cognition and their language, it will be helpful for them to at least download, or they can print out the NIH stroke scale. From there, you're going to have a couple images. One is going to be the cookie theft picture, and that's going to be helpful for assessing if they can really be able to look at an entire scene, and are they picking up on different pieces, or do they have a field defect, or do they have neglect on one side of the image? It's also going to download images of everyday objects that they are going to have to be tested for during naming, as well as a couple sheets left on words to test for dysarthria, and then finally a sheet with sentences to be able to assess how they read. The separate piece of paper and pen that you'll have will be very useful in assessing can they write out a sentence. For the vision testing portion of the visit, there are also a couple key links that I will provide for you in a document. One is the Amsler grid, which you can use to have them test for their visual field, particularly of just their central vision. The Snellen chart will be used to check for their vision to be able to see what their visual acuity is. And that can be something, again, that they can pull up as a link on their device, or they can print it out. It just needs to be positioned 4 feet away from them. The Ishikawa vision testing is important to assess if there's been any optic nerve injury. So for instance, if you're seeing a patient that has said that they've lost vision either abruptly or maybe due to an optic neuritis attack or a stroke in their eye, this is where this is helpful. And that is, again, a link that we're providing to you that you can share with the patient. You can screen share it, you can download it, they can print it out. And from there, they need to be about 14 inches away from the screen. I've also included another link called Eye Handbook app that has various different applications of what I just mentioned. I find that the other links I've provided you are the easiest, but just for your awareness that there is such an app. Well, hello, it's Dr. Coe here, and I'm assuming that I am speaking with Dr. Devin Mackey, yeah?
That's right.
That's right. Well, before I start, I wanted to just double check a few things as part of just the procedure of going forward with the virtual exam. I know that in the past, we've had a chance to meet in person in the office, and this might be our first time having a virtual encounter. I wanted to just verify and confirm that you are indeed in the state of Indiana as we do this visit.
I am. I'm in Indiana right now.
Okay, excellent. With that said, just like when we have an in-person visit, this situation with your private and healthcare information, it is still protected just as it would be in an in-person setting. The platform that we're using right now is also fully HIPAA compliant. And so with that said, do I have your permission and consent to go forward with a virtual video visit?
Yes, you do.
Excellent. Perfect. So vital signs, we've talked about a little bit regarding whether or not they have the equipment that they have available at home to use. So whether that's the blood pressure machine, a home weight scale, a thermometer. You'll next go into doing a general inspection of the patient. So you can check if there's going to be any skin changes, perhaps any hair loss, hypopigmentation, or any temporal wasting, okay, which can sometimes suggest that there is some nutritional issues. From here, we're not going to do the formal Montreal cognitive assessment in the video. However, there are different ways to check for cognition, which I outlined above using the NIH stroke scale. So you'll have them do the cookie theft picture, you'll have them name different objects, read the words, and then following that, read the sentence. And that's going to assess a couple things, right? That'll assess their fluency, naming, repetition, reading, writing when you have them write a sentence, as well as comprehension. In advance for you to take a look at and grab. Do you have those handy there?
I do, yes.
Okay, so the first thing that you might have is a picture, a drawing that is depicting a scene. Would you be able to just take a look at that right now and describe to me what you see?
Sure. I see a young boy, and he's standing on a stool that's tipping over as he is trying to get into a cookie jar. And there's a younger girl with him watching him do that. And then there's also a woman who is washing dishes, and she appears to be distracted as the water is flowing out of the sink and onto the floor, and she's not aware that the little boy is getting into the cookie jar.
Lots of things happening in that picture.
Yes.
Yes, no, you described it really well. The next document that I had you be able to pull the link of is an image with different pictures on it. Do you have that one handy?
Yes, I do.
Okay, if you can go ahead and just describe for me each one that you see.
Yes, in the top left corner, I believe I see a glove. In the top right, there is a key. In the center is a few cacti or cactuses. There is a chair on the right side, and then a feather on the left, and then toward the bottom looks to be a hammock between two trees.
Excellent. The next sheet has some words on it. Would you be able to read me those words?
Yes. Mama, tip top, 50-50, thanks, huckleberry, baseball player.
Fantastic. And then the last one has a series of sentences. Would you be able to read those out loud for me?
Yes. You know how, down to earth. I got home from work. Near the table in the dining room. They heard him speak on the radio last night.
Excellent. We can actually set those items aside. Would you be able to repeat after me? No ifs, ands, or buts.
No ifs, ands, or buts.
Excellent. And do you have a piece of paper with a pencil available or a pen handy?
I do. Okay. Okay, I have a pen and a paper.
Perfect. Would you be able to write out for me the following sentence? Today is a sunny day.
Yes. Okay. Do you want me to show that sentence?
Yeah, I would love to take a look at your handwriting, and excellent. Well done. Thank you so much.
Mm-hmm.
Praxis. When we have a patient mime different gestures, that's helpful in assessing whether or not they can understand components of praxis. So that would be, how would you utilize a brush to comb your hair? How would you use a hammer if you had to hammer in a nail? The next step, I wanted to just ask you just some basic things. Like if you were to have a hairbrush in your hand, show me how you would go ahead and brush your hair. Very well done. Your hair looks fantastic. And then if you were to have a hammer, would you be able to show me how you would use a hammer if you were trying to pound down a nail?
Yes.
Perfect. Thank you. Calculations. We can ask the patient to add or subtract, and that is a helpful piece also to cognition, particularly if there's been a concern of stroke or a posterior event.
5 plus 7 would be 12.
Excellent. Cranial nerves. For the pupils, you're going to ask the patient to approach the camera and then observe the pupillary response to light. They are going to have their flashlight or the flashlight application on their mobile device, and you're going to instruct the patient or their care partner to shine the light using the flashlight first in the right eye and then in the left. In the ophthalmic, neuro-ophthalmic world, we always do the convention of the right eye first and then the left. You would then have them move that flashlight from the right eye to the left across the bridge of the nose, about 1 Mississippi of a second, going back to then the left, 1 Mississippi, back and forth, so that you have that kind of cadence and rhythm. Alternatively, if they have a care partner available, you can ask them to just turn off and dim the lights in the room as they're looking very closely into the camera to see if you can see a pupillary response. With individuals with very light irises, you can sometimes be able to tell the pupil reactivity just by flicking on and off the lights, which would be the easiest way. Visual acuity. This is best done by pulling up that link that I provided for you. If they've printed it out or they have it on their screen, they can just go ahead and you can instruct them to be 4 feet away from the image and then go ahead and read the lowest line that they can see. You'll see in the video that I'll have them first cover over their left eye to test the convention of the right eye first, and then to flip over, cover over the right eye, and test the left eye. Color vision is very similar in the same manner, using the link, testing first the right eye, then the left eye, but at this distance, it should be about 14 inches and not 4 feet away, as with visual acuity. Next, I had you just have that visual acuity link, which is that eye chart that you see at your eye doctor's office, ready. Would you be able to go ahead when you're ready and read for me the lowest line you can see, starting with covering over your left eye and testing your right eye, and then we'll swap out. At this point, I'll have you sit 4 feet back as you've just done.
I'll start out with my right eye.
Yep. If you could read with your right eye, covering your left, and read the lowest line for me.
Okay. And I think I can see most of the letters on line 11, which is PEZOLQPTD.
Thank you. And now I'd like you to swap over, cover over your left eye. I'm going to actually have you read that same line, the lowest line you can see. And if it's the same line, I'd like you to read it backwards.
Okay. Line 11 backwards is DTFCLOZEP.
Outstanding. Thank you. You can now move back closer to the screen, and you had a link available to be able to check your color vision, also called the Ishihara color plate test. Let me know when you're ready.
Okay, I'm ready.
And we'll have you cover over your left eye to test your right eye. And if you could go ahead and read each one as you scroll through each plate.
12, 8, 5, 29, 74, 7, 45, 2, 16, 35, 96.
Excellent. And now I'll have you switch over, covering over your right eye, testing your left eye, and read those for me again.
12, 8, 5, 29, 74, 7, 45, 2, 16, 35, 96.
Outstanding. Visual fields. So what I'm going to have you do, as you'll see in the videos, you're going to position the device so that it's a fixed distance from the subject. And then you're going to instruct the patient to fixate on either the camera or they can fixate on the examiner's nose. In the case of the video, I had them look straight at my nose. Ask the patient to cover one eye, and usually by convention, we start with covering over the left and testing the right eye first, and then having them focus straight ahead, either at you or at the camera. And then while reminding them to fixate at that location, you're going to present a finger count in each of the quadrants, okay? You'll do that then when you have them switch over to the right eye and do that for the left eye. Another very simple way to also test for any central vision loss is to have the patient stare right at the examiner's nose, face, and see, is there any parts that are missing? When you have them stare at your nose and then you provide your thumb. You're trying to see if there's any central scotoma that's present. Typically, it should be that they feel that your nose is sharper than your thumb when you're putting them adjacent to each other. Our next part, we're going to test some of your peripheral vision. So we're going to make sure we're both positioned. You should be able to see me in full frame at this point. And what I'll have you do is cover again over your left eye. So that we'll start with your right eye. All right. And I'll have you look right where my nose is in your field of view. And then go ahead and tell me how many fingers you see.
2, 1, 3, 2.
Well done. I'll have you now flip over to the other eye, staring right back and fixating on my nose on your screen. And again.
2, 1, 1, 3.
Outstanding. All right. If you're looking fully at my face right now, I'm going to have you cover over your left eye, looking with your right eye. Any part of my face missing or blurred?
No, your face is all there.
Right. And when you're comparing looking right at my nose, keeping your left eye covered, which is clearer, my nose or my thumb?
Your nose is clearer.
Excellent. We're going to do that on the other side as well. Same thing again, looking right here at my face. Any parts that are missing or unclear?
No, nothing missing or unclear.
And when you're comparing between my nose and the thumb, looking right at my nose, which is clearer?
The nose is clearer.
Excellent. All right, you can now relax your hand there. The ocular motor assessment. So ideally, the goal is to keep the camera about 10 to 12 inches away from the patient's face and then have them cover over their left eye while testing the right eye first. And I advise them to then look all the way to the right, all the way to the left, having them look up and then down to the floor, and then repeating the same thing with the left eye. In order to test pursuits, it's a little bit trickier because you need to make sure that the refresh rate on the broadband speed is sufficient enough. Nonetheless, you would have them not cover either eye, so they're looking at you with binocular vision, and then having them look all the way to their right, to their left, up and down, and you're trying to make sure that their pursuits are smooth and are together. And up, and then down. Perfect. You can look right back at me there. Excellent. Cranial nerve 5. Here is where you're going to have the patient grab that cotton swab or that piece of fabric, and you will test their V1, V2, and V3 distribution, so upper, mid, and lower face respectively, on the right and the left side, and seeing if they feel that it is symmetric. You can also have them, if they don't have a cotton swab or a piece of fabric, they can also try to test each side of their face with their fingertips. If someone is present, like a caregiver, even better. Have them close their eyes and then have the caregiver test each side and ask if they can feel both sides symmetrically. Cranial nerve 7. So here's where you're going to have to ask the patient to raise their eyebrows, smile, puff their cheeks out so that you can test all aspects of the 7th nerve. And then go ahead and lift up your eyebrows as well. Excellent. Cranial nerve 8, 9, 10, 11, 12 can be tested in the following way. You can use finger rub just like you would typically do and have the patient rub their fingers on the right and the left to make sure that they can hear both sides symmetrically. Assessing their palate and seeing if they elevate it symmetrically, it could be a little bit trickier, but having them draw close to the camera and then flashing the flashlight in to help see if they actually do elevate their uvula, and go ahead and have them say a good ah. You can have them stick out their tongue, check that it's midline, that there's no fasciculations, and that there's no atrophy on either side. And moving it from side to side as well. Very good. Thank you. So with the motor exam, a lot of it is going to be observational. You're not beside them to be able to test them. And it can be difficult to be able to train a caregiver on the spot as to how to grade strength. So the way to do this is to assess their range of motion, because if they're able to at least lift anti-gravity, you know that it's at least a 3 out of 5 strength. If there is a family member present, certainly you can see what their ability with their biceps and their triceps, as well as their deltoid strength is. You can also have them check the strength in their legs as well. The pronator drift is as before. You would have them hold out their arms and then close their eyes to see if there's any drift. The other one that I wanted to show you that's a great sign to look for any subtle weakness is called the satellite sign. So you would have them basically do a pinwheel maneuver. And if there's any weakness on one side, say hemiparesis after a stroke, you will see that the stronger arm just satellites around the weaker arm. You'll test for fine finger movements for any asymmetry. And then functional testing is really the most useful way to assess strength in the teleneurological exam. So what do I mean by that? It means actually being able to see what things they can do. So if it means crossing your arms, and I'm going to have you stand up from your chair, from the seated position, not utilizing the strength of your arms to be able to stand up, that gives you a lot of information about their strength and coordination. The other thing you can have them do, if it's possible and if they are able, if you have them be able to do a sit-up, that tells you a lot of information. If they're able to do a leg squat on camera, that also gives you a lot of information about their lower extremity strength. Some other basic test functions that you can use to assess muscle groups of interest include, like, using a bottle opener, a can opener, and seeing if they can utilize and manipulate those types of tools with their hands, and walking on their heels and toes, which we will discuss in the gait section. All right, we're going to test your strength at this part of the exam. Obviously, we're not in the same location, so it's going to be largely based on observation. The first thing I want to do is just test your range of motion, Devin. Would you be able to go ahead and lift your hands above your head here, and then kind of show me strong arms this way as well? And can you put your hands out straight ahead? Take a look at that. And then flip them over so that you are like holding something. If you can go ahead and close your eyes and keep your hands up there. And then I'm going to actually embed in your coordination at this point. If you can close your eyes, but then take your index finger on your right, touch your nose. And same thing on the other side there. Perfect. And then you can open your eyes at this point and go ahead and relax your arms. The next part that we're going to do is actually test how strong you are with getting out of the chair, but without using the armrests or your arms at all. So if you can take your hands, cross them over your chest, and then go ahead and stand without any other supports. Excellent. You can go ahead and sit back down there. One other test for strength, if you can actually take your hands, almost like you're doing a pinwheel, and just spin them around in front of each other. Well done. And then go backwards for me. Perfect. All right. I'm also going to just test for some of your fine movements of your fingers. If you wouldn't go ahead and just take your right hand and then go ahead and just do some quick finger taps. Excellent. And then switch over to the other side for me. Perfect. Reflexes. It's going to be very difficult to examine the reflexes. Maybe at best, the patient could take a spatula and they can tap their patellas, but to be able to grade their reflexes for someone who's outside of the medical system, that's going to be very challenging. And so typically we go ahead and forego that. Sensation. Here's the opportunity to be able to instruct the patient either with light touch throughout, either by themselves or with a care partner helping to test their sensation on their right versus their left. This is where that ice bag that you had them get prepped up in the Ziploc bag is really helpful to test cold sensation on each side as well. So with coordination, here we can do finger to nose or finger to chin. In either technique is perfectly fine. You can ask the patient to move their camera so that they're facing it fully head on, and then have them move their index finger on their right from their nose or their chin back to the camera, back and forth, and then have them switch over to the left-hand side. If their camera is small because they're on their phone, you can certainly have them extend both arms and then take their right index finger to their nose or to their chin and have them touch their extended left finger, and then do the same thing on the other side. If there's a caregiver present, certainly you can instruct them to provide the opportunity to do finger to nose or finger to chin between the partner's finger and the patient's chin or nose. Dysdiadokinesis. Ask the patient to perform cycles of repetitive alternation of pronation and supination of their hand as fast as they can and as precisely as they can, first on the right, then on the left. Flip it back and forth, and let's see how well we can kind of cook both sides of that pancake. And then same thing on the other side, please. Well done. Heel to shin. While they're in a sitting position, which is probably the easiest position that you can do while on screen, ask the patient to lift one leg and then with the heel of that leg to run it up and down the opposite shin and up and down that knee, down to the ankle, back up to the knee again, and then repeat it on the other side. Leg and run that heel up and down from your right top of your right knee all the way down. Perfect. And then same thing on the other side, going up and down. Perfect. Gait. So here's a comment about this. Oftentimes, our neurological patients have a lot of instability issues. So if the patient is alone and they are not steady or they are a fall risk, they should not do this portion of the exam. However, if there's a family member present or maybe even more than one, then this could be an opportunity for a safe way to assess it. And that's going to be something that you're going to need to gauge with your preceptor as well as with the patient and their level of comfort with walking. But in the instance where they are comfortable with walking, you will observe them seated at a distance from the camera so that you can see their whole body, and then ask the patient to rise without use of their arms, and then ask them to walk either independently or with their caregiver holding the camera to be able to visualize their whole body. If there's no caregiver present, but they are safe to walk, you can place the camera or the phone with the camera on the floor and then have them walk a length of the floor of the hallway. All right, this portion, we're going to take a look at your walking. Devin, if you can walk towards the camera like you would normally walk, go ahead. And then if you can turn around and then walk with one foot directly in front of the other, sort of like a tightrope walk. Excellent. And then if you can walk on your tiptoes towards the camera. Perfect. And then if you can turn around and then walk on your heels away from the camera. Perfect. Excellent.